There is something very special about this time of the year when every April, tens of thousands of families hit the streets to raise money by taking part in the March of Dimes March for Babies. The Houston March has long been one of the largest and one of the most fun in the nation. And this year, it's going to take place Sunday, April 23rd at the University of Houston. There are many reasons why you should plan to try to take part in some way. Anyway, joining me to talk about this year's event and the impact the March of Dimes can continue to make with your support, Alicia Lee, the Director of Collective Impact. Good morning to you. Thank you for being here.
Good morning. Thank you so much for having me today, Camberell.
Yeah, it's my pleasure. Are you like me when you see those folk on March for Babies Day? It's just something unique, isn't it?
Absolutely. So in Houston, we're proud to be the #1 walk, the #1 March for Babies in our country. We expect around 5,000 to 6,000 people to come, bring the family. We have something for everyone. We'll have music, we'll have games, we have giant Jenga, we'll have some inflatables, we'll have food trucks. We start with a walk and then join us for the festival in March for Babies Town.
And this is a signature, it's one of those special years too, isn't it?
This is, absolutely. This is March of Dimes. We are celebrating our 85th anniversary this year. And we started with President Franklin D. Roosevelt put out the call to all Americans. I call it the first crowdfunding campaign. Yeah, he asked everyone to send a dime to the White House. And with the funds raised, we were able to pioneer research for polio vaccine and the eradication of polio.
And now we're dealing with prematurity and now maternal health, trying to find ways to stop premature births, which are continue to be a problem. Talk about one of the specific initiatives going on in the Houston area that's devoted toward that.
Sure, yeah. So unfortunately, Houston March of Dimes has a report card every year. We give everyone a grade of how you're doing. And here in Houston, Harris County, unfortunately, we have an F. Our preterm birth rate's about 12%, which means 1 in 8 babies is born preterm. And we know that the health of mom, the health of baby, it's intertwined. And one of the leading causes of maternal death, unfortunately, has to deal with cardiovascular conditions, with your heart health. And so one of the initiatives we have had is how do we encourage women, pregnant individuals, to know their blood pressure, to know your numbers. And you would think that having a home monitoring kit, having a home blood pressure cuff would be something that is easy to access and easy to know what your heart health is, and then if you are having some high blood pressure numbers, to call your physician. However, that's just not accessible to many Houstonians.
Yeah, I'm sure that a lot of the research you're doing lets you know that that's one of the problems, that accessibility is one of the problems. Also looking at disorders, substance use. I saw that on the website, substance use disorder, and I thought, what is that? And you say that's just another way of saying substance abuse.
Yes, it is. So again, another leading cause of maternal death is behavioral health, mental health conditions, as well as substance use disorder. So women who are using illegal substances. And so we've started a provider education awareness called Beyond Labels. It's a statewide initiative. We've been able the past year to train over 900 healthcare professionals, physicians, social workers, nurses, community health workers on what the stigma is associated with pregnancy and mental health, maternal mental health, substance use disorder, and what are those resources? What are the educational components that you can know as a provider to then be able to work with your patients? So
when you get that grade that comes out and Houston gets an F, it's not within your control necessarily, other than to make people aware of the problem. You don't actually. We raise money, the March, and I say we because I've been involved with this for a long time. We raise money, but that money goes to help what? To help try to change those grades.
Yeah, absolutely. So we work with organizations. The beauty that I get to do is I get to work with community-based organizations through what we call a collective impact model. So how do we all come around a cause, a complex problem? prematurity, maternal death, and how are we working together? And so right now, we have actually just started recruiting our first cohort to develop a community-based doula training initiative, working with 4 organizations who are doing the work, and how do we collaborate individually to train women to become a doula. She is a non-medical professional.
Right.
She provides support, education, advocacy for the birthing person, for their partner during that prenatal, delivery, the postpartum time, on how they can be an advocate for themselves, and provides continuous support to her.
So I noticed that a lot of times when we talk about the maternal death rate, that African American women, women of color, are the ones who are the highest risk on that. Is the doula program something that is specifically focused on trying to help women of color get through this process a little bit better?
Absolutely. So we are recruiting individuals, women of color, to become doulas in our first cohort, in our first training program. And we want them to serve our community, to serve our women of color, particularly our Black women, because of the inequities that are existing in those outcomes that we're seeing for moms and babies.
Well, I've seen it work. My daughter used a doula for both of her children, and it was exceptional. When there were challenges along the way, the doula was right there and was really helpful throughout this process. So first step is to get out and be a part of the March for Babies. What's the best way to do that?
Absolutely. Join us. You can go to marchforbabies.org. We invite you to join us as we honor, connect, unite, and care for all of our families.
Well, I am looking forward to it. I hope the weather's good that day. I don't know who knows what the weather's going to be like, but we're going to look and see what that's going to be like. Thank you, Alicia, for all you do. Good luck, March of Babies. And I know we have different walks in different places. So the March for Babies, you may do Montgomery or Sugar Land or different places, but come on out and do it. I look forward to seeing you on the 23rd.
Absolutely.
We're going to pray for good weather.
Yes.
Yeah, okay.